Welcome to our first therapy series, and in this one we're going to be following a case from initial intake assessment through successful treatment of therapy. So I will be the psychologist in here, and we will have a patient, and we'll start with informed consent and intake. Hi, I'm Dr. Maack.
Hey, John.
John, okay, I'm going to take a little bit of look at some of the papers, looking at everything you signed. I know you had a lot of papers to go through.
Yeah, it's a bunch of stuff.
Yeah, and so just before we get started, I want to review a few of the things that you read and signed, just to make sure we're on the same page here. So everything that we're going to talk about here is considered confidential, which means nothing that you say is going to go beyond these walls. However, there are a couple of exceptions to this. One would be if you tell me that you're going to kill yourself or someone else and we can't make a plan to keep you safe.
Yeah, no, that won't be a problem.
Okay. A second thing is if you tell me of any child abuse or elderly abuse that's occurred or is occurring. I'm going to report that.
Yeah, that's fair.
Okay.
We're not going to have a problem with that either.
And the only other reason where your records might be, confidentiality might be broken would be if a judge were to subpoena your records. But if that would be the case, I would talk with you about that before I would ever give those records up.
Yeah, hopefully it won't be a problem.
Right. And the other thing I wanted to mention is that Oxford is quite a small town. So if you were to see me out at Kroger or at a game or something like that.
We don't have to worry about that.
Well, just to let you know that if you see me, if you want to say hello, that's perfectly fine. But unless you come up to me and talk to me, I'm not going to act as if I know you because I respect your confidentiality.
Okay.
Okay?
Yeah, I guess a lot of people might wonder why I'm talking to you. So.
Right, so I leave that up to you. If you want to talk to me, that's great. If you don't, that's perfectly fine too.
Okay.
Okay? All right, so today what we're doing is an intake session. So I'm going to be asking you a ton of different questions, okay? I want to rule in what symptoms you're experiencing as well as rule out what you're not experiencing so that we can come together with an understanding of the symptoms that you're exhibiting and how to best treat it.
Right.
So if you were to feel comfortable here and to come back for therapy, it wouldn't be me just asking you these questions. We'd be more of a collaborative figuring out how to build your tools and techniques to deal with your concerns.
Okay.
Okay?
Mm-hmm.
All right, so let's get started here. I want you to think about how you've been feeling the last couple of weeks. Have you been feeling down or depressed most of the day, nearly every day?
No.
No? Okay.
I mean, I get dejected sometimes, but it's not, a few minutes here and there.
Okay, so dejected sometimes.
Yeah, just frustrated with everything, but it's, not depressed.
Okay. And in the past 2 weeks, have you lost interest in things that you used to enjoy or find that you're not getting pleasure out of those things? Okay. All right. And do you have a history of depression? So 2 weeks or longer where you're feeling really down and low?
No.
Okay.
No, I mean, not that I can remember anyway.
Okay, great. Okay, so during during the last 2 years, have you had a low mood where you're low energy?
Not usually. I mean, like I said, just a few minutes here and there. But,
Okay.
I mean, I don't know, maybe a little longer, but not persistent or anything.
Okay. All right, how about in the past month, did you think that you were better off dead?
No.
Okay. How about, did you want to harm yourself in any way?
No.
Okay. Did you have thoughts of suicide?
No, I never had that kind of thing. I
Okay.
want stuff to get right, I'm not inclined in that direction.
Okay. All right. Have you ever, and I'm talking for a period of time, a week or longer, felt so up or energetic or high on life where people thought you weren't your normal self or you were more impulsive and got into trouble?
You mean like manic?
Right, we're looking for, okay.
I'm pretty even most of the time, except, all the freakouts lately.
Okay, so some of the freak out. But what about, have you ever been persistent irritable to the point where you lash out at other people who you don't know, not just friends or family?
I'm usually pretty easy, I think, to get along with.
Okay. All right. Okay. Okay, and how about, have you ever, on more than one occasion, have sudden spells or attacks where out of the blue you felt frightened, fearful, or uncomfortable, even in situations where most people would not feel that way?
Yeah.
Okay.
That's primarily what's bringing me in, you know.
Those freakouts you were talking about?
Yeah. Yeah, it kind of started when I'm an economist. I work for a bank. I basically sit in front of a spreadsheet and play with numbers all day long. But for some reason, they want me to travel in the recent past, and I never really have, and I don't like it. And
Okay.
having to get on the plane, you know, I got to the point that I actually had to get off of a flight. Thought I was dying, you know.
Okay. Okay.
Just heart wouldn't stop, or even think about it now, you know, I get kind of
Starting to get a little bit amped up here.
wound up, intense, just shaky, you know. I don't know what's wrong with me. It's never been problematic before, but.
All right. So let me ask you some more questions about this specific stuff. When you have this kind of rush of panic, do the spells peak within about 10 minutes? So just all of the symptoms time to come up?
I mean, if I get away, yeah. If I get out of wherever I'm at, then usually they go away pretty quickly.
Okay. So at any time in the past, did those spells or attacks come on unexpectedly or can occur in kind of an unpredictable manner?
Well, yeah, that's sort of what brought me in. You know, I didn't really like it, but I got it being on the plane. You know, I'm kind of afraid. It's crammed in. There's so many people. You know, just it's a scary situation for me. But then, you know, over the last couple of months, it just started happening all the time.
Okay.
I mean, I'm not doing anything at all. I'm just sitting at my desk, and then I'll start to flip out. Like I'm waking up in the middle of the night, like sweaty and just heart's going, and I don't understand what's happening. You know, it's something from one very specific scary thing to now like my whole life is set up around this stuff.
And it sounds like it's been happening for a month or so. And are you consistently worried about having another panic attack?
Oh yeah. Okay. As it finally brought me in, it's like, you know, it's gotten worse the last couple of months, and trying to sleep, and I can't even go to sleep to get away from it. You know? It just gets in and just squeezes, even when you're unconscious.
Okay, so I want you to think about the worst panic attack that you can remember.
Yeah.
Okay, do you have that pulled up in your mind?
Oh yeah, that's the one where I had to get off the plane.
Okay, so I'm going to go through and list a bunch of symptoms, and you tell me if you've experienced those in that worst panic attack. Okay. So did you have skipping, racing, or pounding of your heart?
Yeah.
Okay. Did you have sweating or clammy hands?
Yeah, no, I felt like I was underwater almost, just like it was so sweaty.
Were you trembling or shaking?
Yeah.
All right. How about, did you have shortness of breath or difficulty breathing?
Yeah, I mean, I thought I was having a heart attack. I thought I actually got off the plane and went straight to the hospital.
Okay, that was actually going to be one of the symptoms I was asking if you thought you were dying.
Yeah.
Some people describe a choking sensation or like a lump in their throat.
Yeah. Even sitting here, I was thinking about it. You know,
starting to get
dry and like tight.
Okay, and so what about chest pain or pressure or discomfort?
Yeah, I mean, that's, you know, I always heard like sagittal, is that the right word? The middle? Like if you hurt there, you're probably having a heart attack. That's what it felt like. Okay. Like an elephant.
Just kind of sitting right there. All right, yeah, very uncomfortable.
Have you ever seen those old Norse paintings of nightmares, like the gargoyle sitting on the chest? Like that's what I had in my mind, like a picture.
What was kind of happening.
I wake up thinking that a lot of times, like just.
Okay, that just heavy, uncomfortable.
Yeah.
Did you have experience of any nausea, sudden diarrhea, or just stomach problems?
No, that doesn't happen.
Okay.
Typically.
What about feeling? And when you think about this worst one ever, when you were on that plane, were you feeling dizzy, unsteady, lightheaded, or faint?
Yeah, I mean, I thought my brain wasn't getting oxygen. I thought.
Okay.
You know, the lights were about to turn out. I knew if I didn't get off that plane right then that I was going to pass out and then fall out in the aisle and you know, be really embarrassing.
Okay, all right. So did things around you feel strange or kind of detached, kind of like you were detached from part or all of your body?
You feel like you're floating.
Some people call it as floating, or some people say they're kind of like they're on their cloud looking down at their body.
I sort of, I didn't really have like out of body perception, but like, I don't know, it felt like I was in a fog, like
Okay,
everything was
unfamiliar or detached.
yeah, like I was dreaming.
Okay.
Almost like, yeah, this stuff happening was happening to somebody else.
Okay. And I know you said you were afraid you were dying, like having a heart attack. Did you fear that you were losing control or going crazy?
Well, yeah, because I mean, once I get to the hospital, I was like calm, you know, the heart attack went away. I was like, heart attacks don't go away, and
Right,
what
but
the hell, like
panic
you know.
attacks do.
Well, I didn't know that. I mean,
Right.
I had no idea that people at the ER, they ran like 1,000,000 tests,
And
they said nothing was wrong with my heart, you know.
and that's great to know, right? Because we can rule that out. But we know that most people with panic disorder are seen at the ER before they ever get referred to mental health.
Yeah, no, they didn't have anything for me. They just said, we don't see anything wrong now, go home, you know,
Okay.
see a cardiologist. So I did, and then, you know, it's happened again. I went like 3 more times at home before finally ran into somebody that was like, I think you're having panic attacks.
Okay.
And he prescribed me some stuff, but you know, I didn't like it. It basically just knocked me out.
Okay. Do you recall if that was Xanax or Klonopin?
Xanax, yeah, or whatever the generic is, but it's what it was.
Okay.
And it was just, you know, I fell straight to sleep every time I took it. I can't function like that.
Okay. And thinking back to that worst panic attack, did you have tingling or numbness in parts of your body?
Oh yeah, no, my whole body felt like pins and needles.
Okay.
Almost like when your leg goes to sleep. That's what I felt like.
Just throughout.
Yeah.
Okay. And what about, did you have hot flushes or chills?
Yeah, it was hot. It's like prickly heat.
Okay, and you said in the past month you've had a number of attacks and you're really concerned about having future attacks.
Well, yeah, and it's starting to mess stuff up. You know, I don't get things done the way I need to, and I can't
Right.
sleep. I can't think. You know, I'm not functioning well.
Okay. And with the panic attacks, do you feel anxious or uneasy in places or situations where you fear that you might have a panic attack, or the panic-like symptoms, or where help might not be available or escape might be difficult?
I think I lost track of your question. That was a lot of qualifications. What do you mean?
So, if you're concerned about having a panic attack, have you started avoiding places or restricting
Yes.
situations?
Heavily. I just told my bank, like, I'm not traveling. There's no reason that your numbers monkey can't just Skype with people, or you know, I mean, nobody needs to see me in person.
Is that what you call yourself, a numbers monkey?
Yeah, that's what they call me too. It's like I don't do anything with people, or you know, just in the back room, like punching buttons.
Okay.
I just told them I'm not doing that anymore. It's too hard. And
Okay.
you know, lately even just going places, you know, like since I can't sleep, like I end up going to the grocery store in the middle of the night. You know, nobody's there.
I was just gonna ask, is that because the crowds and it's...
Yeah, I went, you know, not long back. I guess it has been a while. It's this summer that stupid race car movie, you know, like with The Rock and the British guy.
The Fast and Furious ones?
Yeah.
Okay, yeah.
I went to see that, but I love those movies. They're just ridiculous, you know, goofy fun. But like I went with my wife. Like I was like, I gotta go. I couldn't make it past the previews, you know.
Okay, so just that escape, that needing to avoid.
It was so crowded. It was open at night. You know, I was excited to go and to see it, but I couldn't be in there with all those people.
Okay.
I've never been like that. We always go on open at night.
All right, so this is fairly new and scary
Yeah.
and uncomfortable.
Yeah, even just, you know, I don't like thinking about this stuff.
Okay. In general, if we take the panic stuff type of way, in general, in the past month, were you fearful or embarrassed being watched or being the center of attention, or felt fearful of being humiliated?
I mean, not typically.
Okay.
I've never really been like that. I don't,
Okay.
you know, I'm not very outgoing, but I don't really get worried about people judging me or anything.
Okay. And so things like public speaking or eating in public.
I do that all the time.
Okay. All right. Let's see. Okay. In the past month, have you been bothered by recurrent thoughts, impulses, or images that were kind of unwanted, distasteful, or inappropriate, that you can't seem to get out of your mind no matter how hard you try?
I when I wake up at night, like I was saying, you know, those nightmare paintings. I don't know if you've ever seen them. They're really kind of creepy. It's like, you know.
You said like the gargoyles from.
Yeah.
Mhm.
You got like a Viking laying down with his eyes open, like scared, and there's a
Okay.
gargoyle-looking thing on his chest. Like I just when I wake up at night, you know, that's what I see. And I know I'm not crazy. I know there's not a gargoyle there, but like it won't. I can't get it out of my head when I'm freaked out.
Is that when you're panicking?
Yeah.
Mm-hmm. Okay.
Once I calm down and realize what's happening, it goes away. But you know, for a couple minutes, that is not enjoyable.
Okay. In the past month, did you do something repeatedly without being able to resist doing it, like washing or cleaning excessively or counting or checking?
You mean like OCD?
Mm.
Well, I mean, I think anybody with a PhD and emphasis on statistics has some obsessionality, but like I don't think it's problematic.
Okay, nothing that's distressing or
I
problematic.
was laughing because I think like clean, you know, my wife would say, no, he doesn't have that one.
But maybe the numbers and counting, like
Yeah.
if you are the numbers monkey or the.
Right, it's got to be right.
Okay,
You know?
great.
But not beyond like that.
Okay, all right. Now, so what we're looking for are things that might be distressing or impairing your day-to-day experiences.
No.
Those are the things we're really trying to look at.
No.
Okay. How about, have you ever experienced or witnessed or had to deal with an extremely traumatic event that included actual or threatened death or serious injury to you or someone close to you?
No.
Okay.
Thankfully.
Yeah, no kidding. That's great to hear. All right. So in the past year, how much alcohol do you drink?
I don't drink at all.
No drinking at all. Was that ever a problem for you?
No, just people in my family, like, you know, distant relatives, but I just decided if I had any genetic proclivity, it'd just be better to avoid that. Yeah.
Okay. So what about in the last year, any illicit substances? So marijuana, cocaine, acid?
No,
Okay. How about overuse of prescription medications?
I don't like to take anything if I can help it.
Okay. I know you said that your reaction to the Xanax was just kind of
Yeah.
totally sedated you.
Yeah, I know people take that all the time. And it's like, how do you stay upright, you know?
Okay. All right. So now I'm going to ask you about some unusual experiences that some people might have. I know you kind of joked about this with the gargoyles, but have any experience of hallucinations? So hearing things or seeing things that other people don't hear or see?
No. Once I wake up, I'm about to get that it's a dream. You know,
Okay.
I'm not like seeing gargoyles walking around with me all day or anything.
Okay. Have you ever believed that people were spying on you or any kind of paranoid thoughts?
Well, I mean, I work in finance, so you know, there's a lot of not nice people, but
Sure.
but not like excessively paranoid.
Okay. Or anything that people have had concerns about, or any unusual or ideas or.
No, usually you're insulated from that stuff a lot if you're, you know, the numbers monkey. Nobody else can do it, so they kind of leave you alone.
Okay.
And then most of us are not super management oriented. We're not trying to move up and fight with people or anything like that. So
Okay. How tall are you?
5'10".
All right. And what was your lowest weight in the past 3 months?
Lowest?
Mm-hmm.
I don't know, maybe 220.
Okay. All right.
I've actively been trying to lose weight, but you know,
How's the exercise going for you?
It sucks right now.
Okay.
Every time I try to run or, get even mildly activated, I'm starting to flip out, so.
All of those similar physiological sensations just kind of.
Yeah.
Okay. Let's see. In the past 3 months, did you have eating binges? So times where you ate a very large amount of food. So we tend to say about 2 or 3 kind of servings, normal kind of meals within a 2-hour period.
Oh, like 3 meals in 2 hours?
Mm-hmm.
No.
Okay, yeah, we're not talking like a handful of M&Ms.
Yeah, or like sometimes we go out to get pizza and have too much, but it's not like I'm not eating all the thing.
Okay, right. All right. So any body image concerns?
I have not concerns. I guess I don't really like being old and attached to a desk all the time and not in shape. When I was younger, I was an athlete, but I don't walk around worried about it.
Okay.
I'm trying to do what I can to slowly, be healthier.
And how it, like the healthy lifestyle changes. And,
Yeah.
Okay.
Yeah.
All right. And are you someone who worries a lot?
I mean, not typically, outside of what I was talking about before, with making sure everything's right,
Okay.
but not in general.
Okay. So more specifically, like in the last 6 months, have you been worried excessively or anxious about a number of things?
No, just this stuff.
Okay.
Like I want to get rid of it, but I otherwise like. My wife always laughs at me like I don't have feelings, it's even all the time.
Okay. Until this started happening.
Yeah, and she's not laughing at this, but
Mhm.
like it's unusual.
Okay. And so you said you're married.
Yeah.
How long have you guys been married?
14 years.
Okay. And how would you describe that relationship?
Oh, it's great. Even with all this, like I would be irritated with me. I would be irritated with me the last 14 years, really. But like
Okay.
she's awesome.
Okay. So you guys have any kids?
No.
Okay. What about other family? Are they in this area or?
No, they live kind of far. Her people are West Coast, and mine are New York, Connecticut.
So you have both of the coasts.
Yeah.
Okay.
And as hard as travel's been lately, like we haven't really seen them a whole lot.
Okay. So you're not from the Mississippi area? Okay. So when did you guys move here?
Right after grad school. Like it was my first job working with regions locally. Kind of moved up to be analyst for all their branches.
Okay. Great. All right. Okay. You mentioned a little bit of, you said kind of extended family history of some substance abuse problems.
Or alcohol.
Or alcohol, sorry, yeah.
As far as I know, not other stuff.
Okay. How about any history, whether it was diagnosed or not, of anxiety or depression or any mental health concerns in your family?
I mean, I don't know, like, that I've ever heard about, but, like, why not talk about it? My mom would sometimes say she had spells, like I just thought she was sick, but she wouldn't come to watch baseball games or football, I played a lot of sports. Sometimes she was just like, I can't, One year we won regionals for baseball, and it was, it's a big deal, and she didn't come to any of the games. And now it's happening to me, I'm wondering if like that was...
Like her spells, like if it was more like a panic type of stuff.
Right, like all those people, all the noise, like I wonder if she was, trying to avoid that.
Mm-hmm. Okay. Anything, any siblings?
I mean, I have a couple of brothers, yeah.
Okay.
But they don't, as far as I know, have this kind of thing.
Okay. So the only person you can really think of is maybe your mom and the spells that she kind of had growing up.
Yeah. Okay. Let's be an idiot count. I have a brother like that.
Don't we all have someone in the family, right?
Yeah.
Okay. And on your paternal side, so dad or?
No, not as far as I know. He's a lot more like me. He just doesn't, not very high strung, usually doesn't get.
So usually even keeled?
Yeah.
Okay. All right. And so you're at Regions. You've been there for a good. You since grad school?
Yeah, 14 years. Yeah.
Okay.
I mean, doing different stuff, but the whole time, yeah.
Okay. Tell me a little bit about your social support.
Like people I see.
Friends, or it sounds like you have a good relationship with your wife, but people who you can talk to, people who you engage with outside of work.
Work out with a couple guys that work at the university, professors. But I haven't seen them a ton lately because I haven't been going. And I'm not typically talking about this kind of thing.
It's not the topic of conversation.
No, we're not really there to share and heal or anything. We're just lifting weights.
Okay. All right. And outside of work, what types of things do you normally do? And let's say both before the panic attacks started to happen and since then, and how things have changed.
I mean, in most of my life, I guess, until I was probably promoted to this position like 35, so 6 years ago. I worked out like a lot. Even post grad school, maybe like 3-4 hours a day. Played competitive, old people sports, not like high level competitive.
What are old people sports?
I mean, like you get a group at a gym that has like a basketball league or
like pickup games, or
I was in a bunch of they're basically intramurals for older people.
Yeah.
Because we can't play against 20-year-olds no matter how good a shape you were in.
Okay.
I like going to movies. I used to go all the time.
You were saying opening nights used to be kind of a thing you and your wife would do.
Yeah, or I like to see all the stupid action movies. Those are fun.
Okay.
I play video games. I guess that's really just about it.
Okay. And how have things changed since you started having the panic attacks?
I can't go anywhere there's a crowd anymore. Like I gotta get out. I haven't been to a movie since that one that ran out of. And keep trying to go work out, but like at a point if you keep making excuses about why you gotta leave after 10 minutes, your friends are gonna sort of be like, "What's wrong with you? Why you keep doing this?" So I just haven't been going at all.
So what have you been doing instead?
Playing games. My wife will play with me sometimes, and I play online sometimes. I like a lot of puzzle games, so you can play them by yourself or with people. It doesn't matter.
But you're seeing how kind of your world is just kind of slowly just shrinking a bit.
Yeah.
Okay.
Well, that's what I'm worried about. Like I don't, much more. I'm not gonna be able to get to work. I'm not gonna be able to do my job, and then I don't know what happens at that point. I'm afraid of that, messing stuff up.
Okay. And just for clarification, the panic attacks started with the airplane?
Yeah.
And that was about 2.5 months ago?
Oh, no, the first one, 7 or 8 months.
7 or 8 months, okay. And it's gotten progressively worse.
Yeah, and I didn't jump off the plane the first time. It was just that the first flight, I hadn't been on a plane, and it says I came here to interview. So it's been almost 14, 15 years.
Okay.
I didn't feel right, but I got through it. And then, I had a couple of flights after that. It just kept getting worse, and then it was like, shaking
just
through
feeling
the
out of
sky,
control.
and I was like, and then, somewhere down the line, that's when I got off the plane, I thought something was wrong with me.
Okay. All right. And I know you said like you went to the ER, you've been there a couple times, they sent you to cardiology, you've had a lot of those workups. Ultimately, someone said, hey, maybe you're having panic attacks, maybe you should go get help.
Well, he just gave me the drugs. He didn't really.
The Xanax, right?
Yeah, I had to look you up online. Like, there's no connection between things. There's no resources.
Yeah, and unfortunately, we see that disconnect often. So I'm glad you were able to find us here. You said you just tried Xanax and not good for you. Are you on any other medications for other things currently?
No.
Okay. Any medical conditions that you deal with?
Well, I mean, I'm overweight at this point, but it's, trying to take steps to fix it.
Okay. So no major medical, no medications that you're on?
No, nothing chronic.
Okay. And so after, so you've been dealing with this for over 8 months or so. So what finally got you to the point where you wanted to look up therapy?
I just couldn't sleep, and then just, talking to physicians, it's like there's a pill for everything. They want to get out of the room as fast as they can, but they don't, as they talk to you about what's wrong. Even the ER doc was like, there's nothing wrong with your heart. You got 3 successive scans, like you're having panic attacks, take this, and that was it.
Okay.
I can't. It just makes me stupid and asleep. So, I tried to deal with it, but finally just fed up. I need to sleep.
Okay, so the sleep, and we call it nocturnal panics, when you're waking up and your body is already activated, and like you said, you're seeing the gargoyles as well.
I could do without that.
Okay. All right. And so you said it was kind of like the not being able to sleep, seeing all of this culminating in your world, your concerns about your job, your not being able to exercise, that really prompted you to come in.
Yeah.
Okay. And so what are your hopes of getting out of therapy?
You mean like what do I want to happen?
Mm-hmm.
I just would like this to stop.
Okay. Well, stop it.
Yeah, that would be lovely. If that would work, I would do that right now.
Well, the good news is that we have some real solid treatment for panic disorder with agoraphobia. And that's what...
agoraphobia.
Mm-hmm. So agoraphobia is sometimes seen as an extension of panic disorder, but there are 2 separate disorders where the concern of not being able to escape or not being able, or fear that you might have panic attacks in situations makes you either avoid or suffer through being in certain places or situations.
Like crowds.
Like crowds.
Yeah.
Like airplanes now. The crowds, you said you'll go grocery shopping in the middle of the night to avoid things.
Yeah.
So you're starting to avoid places that remind you of maybe I can't escape, maybe I won't be able to get out.
Yeah, or just, I know I'm going to freak out, I don't want to be there.
Right, that thought that I'm going to have another panic attack, and so I need to get away, escape, avoid. And then with the concern about having frequent panic attacks and the number that you've had, you'd qualify for a panic disorder, which which you've been told by other providers. And those are certainly things that we can work on, because essentially what panic disorder is, if we go back to some of, well, I guess if you're an economist, I don't know how many maybe science courses you took, but if we
social science.
if we go back to maybe high school classes too, do you remember the fight, flight, freeze system?
Oh yeah, like adrenaline.
Uh-huh. Yeah, so we have all of these great things. That's great if we have what we call true danger, right? So if there were a bear outside, you open the door. It's great if our fight, flight, freeze system is activated, so we can run, we can fight, we can have all of our faculties in the most efficient mode to be able to take on that fear, okay? But imagine when your body does that when there's no real danger.
Yeah, it seems worse.
It's what we call a false alarm. And that's what panic attacks are. They're these false alarms that come out of the blue. And after they start coming out of the blue, you've seen some of the situations where maybe with the airplane, that instead of it being out of the blue, it starts to happen when you're in the same situation. So when you're in the airplane and you might not be able to escape. And you're seeing it generalized too in some ways to exercise, right? Because it's the same kind of physiological sensations.
It's become unpleasant.
And I like to call it like a hiccup. Our body starts to hiccup and we start to be more attuned to the hiccups in our body. And I wonder if you're starting to engage in some behaviors to check. Like some people we might see starting to check their heart rate. We might be more attuned to body scanning for
breathing.
Okay.
I suppose, I don't trying to describe it here. I can feel it. Been paying attention to that.
Right, and noticing those. And so all of those are components of panic. And what, from a cognitive behavioral perspective that we look at when we're helping people understand and subsequently treat panic disorder, is coming from a biopsychosocial model. So are there any biological predispositions, what's happening in the social environment, any temperamental or psychological vulnerabilities that lead you to a certain way of thinking, feeling, and behaving when encountering situations.
It sounds a lot like you're gonna do like you see on TV, like root causes, go all the way back to like when I was 3 or 4 years old.
No, we certainly understand that your learning history can really impact the way you might deal with things now. But regardless of that learning history, we know what we can do to help you understand your panic right now, how you experience it, and how to make changes moving forward to help you understand and be able to have the tools and techniques to really be able to move forward without having this fear of panic and fear of your body just having this hiccup with the activation of your fight, flight, freeze system.
Is that how we do that?
So with the panic protocol, things that we'll be doing, and we'll be talking a lot more about panic disorder and agoraphobia and all of that next session. And what we're going to be doing is helping you learn that the physiological sensations in your body, that they're not something to be afraid of, that it is a hiccup. Your body is overreacting to an increase in heart rate, to feeling sweaty, to feeling some pressure. You've already been cleared by medical professionals that cardiologists, specialists have said your heart is great, there's nothing wrong with you.
Yeah.
Okay, so we can put that to rest that it's anything with your heart. That's already been cleared. So it's this false alarm. And the more that we can help you understand that even if you're sweating, even if your pulse is increasing, that's not something you have to be afraid of.
I mean, I get that. I get at this point that it's not real. I just don't know how to make it stop.
Well, and that's what we call the head versus the gut. Logically, you understand this. Logically, okay, my heart's beating fast. Heart beats fast when we exercise really hard, and that's what we want. We want to have that, get that cardio in. We want to get certain things. Weightlifters have high cardio very quickly, right? But your gut is saying, uh-oh. So logically you're saying, I get it, it's nothing to be afraid of, but your gut's saying, I'm not quite sure. Let's get out of this situation. Let's escape. Let's avoid.
Yeah.
So our job is to work with you so that you can convince your gut that it's okay when your heart rate goes up really fast. That doesn't mean you're going to have a heart attack or you're going to embarrass yourself. So we use different exercise, different what we call exposures. We want to expose you to situations like increased heart rate, like sweating, like having that pressured feeling.
So you want me to do it more?
So that you can habituate.
That sounds fun.
So that we can help you learn that if you stay in the situation and you don't escape or avoid those sensations, that eventually your body is going to go back to homeostasis. That it's going to peak and be uncomfortable. But if you don't escape, then the sensations are going to start to go down without anything, without escaping, without avoiding, without having any safety behaviors. And safety behaviors are things that you might do to prevent the symptoms from occurring.
Like leaving.
Like leaving, avoiding. Some people might, do what they call the Jane Fonda workout, where they're used to being marathon runners or weightlifters, and now they'll do a little. So they'll do a little bit of exercise, but they're not really engaging in the amount that really activates their system.
Okay.
And once you're able to experience that without avoidance, without any safety behaviors, then we're going to convince your gut. And after that, and then it's your logical side and your gut is saying, this isn't something to be afraid of. And usually when we get people to understand that, it's not a problem anymore.
That would be great.
And so those are things that we'll talk a lot more specifically next time about, to help make sure you understand what are these things, safety behaviors, fully understand the panic cycle, and we'll individualize it to your specific situations, and be able to work towards having these planned exercises or exposures to get you to experience these sensations that you oftentimes associate with panic, and to see that just by doing nothing, by sitting with those sensations, you're going to habituate and eventually be calm again. One of our taglines we try to say is, invest in anxiety now for a calmer future.
Yeah, okay. That makes sense.
Okay. So right now, what questions do you have for me? I know I've put a lot of information out there.
Yeah, I mean, nothing really. Just ready to get started.
Okay. And so like I said, next time what we'll do is we'll go over what we call the psychoeducation, give you more detail about the disorder and the treatment, and how we're going to design our first interoceptive exercises. Okay. There is homework here. Part of what we do, it's great that you're here, and we can talk about symptoms, we can understand some of the patterns, but most of your time, or not most of your time, all of your time, except for the hour or hour and a half that we have here, is in your real life, right?
Yeah, statistically, this is 0.
Right, great. Statistically, this is 0. So I ask that you engage in homework, and these are things that are going to help us see different patterns, help you understand your patterns, certainly give me more information about patterns and symptoms, and help whatever skills you might learn here to generalize into your home life, your work life, your leisure time as well.
Okay.
So the first thing, it's just a general, what we call a daily monitoring log. Okay, if you see here, we have days of the week separated by 2-hour increments here. Okay, so the more detailed you can be, it's going to be helpful for me to see patterns, and you might as well. And so during these times, I want you to write down what you were doing. And then I want you to write
very small photos too.
Or I can send you
I can make
a word link. Okay. And then, so write what you were doing, and then on a 0 to 10 scale, I want you to write how anxious you felt. Okay? So with 0 being no anxiety, 10 being extreme anxiety, and I'd like you to put an asterisk if you're feeling panic symptoms.
Okay.
Okay? And this is where I can see, okay, how are you spending your time in a normal week, and how your anxiety or your panic might fluctuate or not throughout that week.
Okay.
Okay? And so anytime if, I don't want you to wake up every 2 hours to say I was sleeping or whatever, so feel free to, in the morning complete that. But again, the more detailed you can be, the more that will help me understand your patterns and hopefully help you see that too.
Yeah, no, I can put that together and run
a regression algorithm or something.
So I would say like a moving average, a rainbow. Yeah.
Okay. All right. So any other questions right now?
No, I'll start on this. See you next week, I guess.
Okay, great. So we'll get you scheduled, and we'll plan to move forward with the psychoeducation next week.
Cool.
Okay?
Thank you.
All right. Nice meeting you.
You too.